It's the Brian Lehrer Show on WNYC. Good morning again, everyone. I'm Bridget Bergen, sitting in for Brian today. Nearly a fifth of Americans are now over 65, and more of us than ever are living long enough to face a slow, drawn-out decline rather than a sudden death. Most of the dying still happens out of view in hospitals and nursing homes, managed almost entirely by medical professionals. But that may be starting to change. There's a growing number of non-medical guides who sit with the dying and their families through the last chapter. This corps of end-of-life doulas has trained more than 10,000 people in the last decade alone. New Yorker staff writer Alexandra Schwartz spent a lot of time with some of them for her new piece, The Doulas Who Help Us Die. One client she followed, a 100-year-old woman named Eleanor, told her doula near the end, "You've added something to this end-of-life thing which wasn't there before. Mighty useful." Joining me now is Alexandra Schwartz and also Virginia Chang, Ph.D., the end-of-life doula at the center of much of her reporting and author of the new book, Preparing for the End of Life for Dummies. Welcome to you both.
Thanks so much for having me.
Hello, Bridget. Thank you so much for having us here this morning.
It's so wonderful. And listeners, we want you to be part of this conversation. If you've worked as an end-of-life doula yourself, we want to hear what drew you to it. If someone you loved worked with a doula while dying or is working with one right now, tell us what that's been like. And for everyone else who's listening who's just curious, what have you always wanted to ask a death doula? Now is your chance. Give us a call, 212-433-WNYC. That's 212-433-9692. You can call or text. And Virginia, I want to start with you. Can you tell us, what does an end-of-life doula actually do?
That's a good question. I think that's the question of every single that comes out of every person's first mouth when you meet them is, what is an end-of-life doula? The way I define it is that an end-of-life doula is someone who guides, supports, companions, and educates about the end-of-life process to a dying person and their family and caregivers.
And how did you get drawn to this work?
Oh, well, it's a long story, which Alexandra did write about in her piece, but I actually came to this work out of personal trauma. There are many doulas who do come to the work out of personal, beautiful experiences in the past, having experienced positive deaths, as well as being very comfortable in the space. And so they want to share that familiarity and that with others. But I came to the work because of personal trauma, and I said, this doesn't seem right. This isn't what death should be like. And I was seeking a better way for myself, and then realized that there's something wrong in the greater picture of dying in society that we should really be considering on how to do this better.
Yeah. Alex, you tell us that this field traces back to a hospice social worker who had the idea to borrow the doula model from childbirth and apply it to dying. What was broken in the end-of-life care that made him think that a birth support model could fix it? And tell us a little bit more about who that social worker was.
That's absolutely right. The hospice social worker you're referring to is Henry Fursko Weiss. He's someone who Virginia knows well. And he trained his first group of doulas at the hospice where he was working in New York City in 2003. The reason that he thought that a new model was necessary for helping accompany people at the end of life was that hospice had sought to be that thing. Hospice itself, which now so many of us take for granted, more than half of people on Medicare will use hospice when they die. Hospice started as a radical alternative movement that came to the United States in the 70s and was meant to help people stop seeking curative care at the end of life and focus much more on quality of life, comfort, both physical and emotional. And hospice expanded very rapidly in this country because it became Medicare approved. And that was a great thing. It meant that people had much more access to it. But it also meant that it became bureaucratized and that it could be hard for hospice to meet the demands of such an enormous clientele. And one thing that Henry Furska Weiss saw was that people were still being neglected, even in hospice conditions. There were people who clearly wanted to die at home, but who were being rushed to the hospital because a caretaker would freak out that something might be happening medically to them, and they would end up dying in hospital. There were family members who had been very attentive to a dying person who still missed the moments of death because they didn't know how to look for signs, physical signs of active dying. And in general, people weren't really being heard around how they wanted to die. People weren't even really familiar with their options, even in hospice. So Henry Furska Weiss created a method that would let hospice workers, and eventually anyone, be able to interact with the dying in a more conscientious, deliberate, and compassionate way, and in a way that would really be able to focus on helping dying people articulate both wishes and ideas and dreams that they had had about their own lives. A lot of this work is interesting because you're looking forward to death, but you're also thinking back about life and trying to make meaning of it. And I think a big part of the doula model that Furska Weiss created was about that kind of meaning making, how to achieve a sense of completion at the end of your life so you can feel that you can let go and you can leave.
Alex, a listener asks the question, is there a difference between a end-of-life doula and a hospice nurse? And I guess I would tack on to that, if there is a difference, what are they, but can they also be the same?
There is a difference. The end-of-life doula is a non-medical role. So a doula will not administer medicine. A doula will not take vital signs. A doula does not perform a medical duty. Absolutely, a hospice nurse could train as a doula and be able to use those doula skills in working with someone. And often you will find that doulas are very experienced about medical symptoms, about the progression that a certain disease might take, because they have a lot of experience with people who are dying. So they may prove very able to help a person navigate or understand in practical terms what medically they're facing, but they won't provide medical care themselves.
In Virginia, one of the things that you said to Alex while she was reporting this story is, if people know about this service, they will take it. That's a guarantee. Why do you think so few people have heard of this profession, given how much demand for there is, apparently?
Well, we are really actually a relatively new profession, even though Henry came upon these ideas in the mid-2000s. They weren't really formalized until the mid-2010, and doulas have only really started becoming into a profession less than a decade. And now that we're seeing thousands of more doulas in the field because of COVID, when people were realizing that we aren't dying well, it's just taking time for people to become publicly aware, to be educated that there is a new resource out there. And I've met palliative care doctors who've never even heard of end-of-life doulas, and they're in the end-of-life care space. So it's just taking time for the word to get out.
You're listening to The Brian Lehrer Show on WNYC. I'm Bridget Bergen, sitting in for Brian. My guests are New Yorker staff writer Alexandra Schwartz and Virginia Chang, a Ph.D. She's a death doula and author of the new book, Preparing for End of Life for Dummies. And we're taking your calls and your texts, but I want to bring in one caller. Her name is Amelia Chiarenza. She is a death doula. Amelia, welcome to WNYC.
Thank you so much, Bridget, and it's lovely to join you both, Dr. Chang and Alexandra.
So can you tell us a little bit about what you do?
Absolutely. Happy to. I am a transition coach and advisor, as well as a death doula. In fact, what drew me to this offering and this space is a bit of what Dr. Chang and Alexandra have touched on, which is humanity. It is a specialized role grounded in humanity, I am someone who's always been passionate about the intersection of humanity and science, and I believe they are mutually reinforcing. And so to tag on a bit to your last question, and Dr. Chang rightfully saying that death doulas and end-of-life care specialists, it's a relatively new profession, and I would also like to add, we've had so many incredible advances in science, technology, and medicine, and fully recognizing what has been gained. There's also something vital that can get and has become lost in a lot of ways, and that's the human art. End-of-life care, doula work, it's part of bringing that humanity into focus so that, both the pieces of science, technology, and medicine and humanity are reinforcing one another. It's a key piece of why I was compelled to become a doula and also to share a new narrative of death. And because it's about living, it's about cultivating our lives. And one of the biggest transitions we will ever have is that of dying and death. And, so it's why I wanted to share this and say, thank you for shedding spotlight on this role and this profession. I'd also like to share that my Tribeca Official Selection podcast, Cultivate Being, it's a record of my quest to get intimate with death, and that it is about living and magnifying how we live. Part of that is in the choices, decisions, and resources that people can become aware of when they are contemplating their mortality and dying.
Amelia, just one question before we let you go. What I'm curious about is at what stage in someone's end-of-life care do they engage with an end-of-life doula?
I believe it's oftentimes thought of engaging a doula when the dying process is near term or in effect. However, my belief is that it's very much the place and time where a doula can be engaged. What I'm passionate about and what I specialize in is it can happen so much earlier. Part of my guiding principles are around that full presence, the clarity, and the cultivation. And that is when someone, maybe they receive a life-altering diagnosis and they want to discover and understand what are all the various resources and care and things that they could be exposed to and their family could be exposed to. That can happen at any point in life. And it can also happen, obviously, in elderly care, but also much earlier in life. So I think it's typically thought of as someone who is nearing the end of their life. I like to think of it as, we're living and we're thriving, and we are also dying. We know this. And so it's a resource that I believe is available to a huge number of people and can provide incredible support and care.
Amelia, thank you so much for joining us and for your call. I want to share a text that a listener wrote. The listener writes, "My mother passed away 8 years ago this week in hospice care. I don't recall working directly with a doula, but I would like to thank the guests and her colleagues for all that they do. Those who specialize in end-of-life care are truly remarkable individuals, and what they provide is nothing short of magical." So, Virginia, to you, and Alex, to your reporting. Alex, you point to the silver tsunami, rising cancer rates among younger people, and the pandemic as drivers of this field's growth. What do those things specifically change about how people think about, what is considered, quote, a good death?
Well, I think in a very clear way, the pandemic, above all, showed us what a really bad death can look like. So many people during the pandemic, particularly in the early stages, were dying in hospital on ventilators, great level of medical intervention that left people suffering but wasn't able to actually prevent death. And of course, because of the conditions of the pandemic, they were away from loved ones and alone. I mean, we know all those heartbreaking stories of people who had to see and speak to their loved ones for a few minutes on FaceTime that, nurses were able to provide on their own phones, for instance, as a way of saying goodbye. Now, those are, of course, extraordinary conditions that happened during extraordinary times. But something did happen in the pandemic where people became aware en masse that mortality is coming for us all. We can argue about whether that lesson has stuck, but I think in something like the death doula, the end-of-life doula movement, and the growth in the field that we're seeing, we certainly know that a number of us were very affected by that and influenced to want to make conditions for dying better all around.
I want to go to some of our callers. We have Ralph in Astoria. Ralph, you're on WNYC.
Yes, thank you. As I told your screen, I'm calling on behalf of a friend of mine that went through the doula training, and she's in another time zone. That's why I'm doing it right now. But her and her fellow students went through a whole year of dying. They did everything that they were supposed to do, in preparation for death, and they spent the whole year doing that. And then they ended, each one of them, I went to her particular one, they ended with a funeral, okay? And a lot of people turned out, and it was so invigorating. It was so energizing. I mean, life was popping all over the place. That it was amazing. We ended up celebrating her life, and it reminds me of a famous salsa song that says, "The flowers that you're saving for my death, could you give them to me in life?" I've never ever experienced something like that. It was I don't know. It was just incredible.
Ralph, thank you so much for that story. I mean, Alex and Virginia, I'd love to get your reaction to that, and maybe you could tell us a little bit more about the field and how it is regulated. The kind of training that Ralph described there. Is that typical?
I'd like to just add one thing that, with regards to what Ralph said, he used words like amazing and invigorating, incredible. And what I'd like to just emphasize to every listener out there is, if you let death into your life, it can be those adjectives. But so many people think that, if you think about death, if you talk about death, it's going to make it happen. Well, you can just hear from the conversation that we're having today that that's not what's happening to the people who are thinking about it, who are talking about it, and to the people who are caring for those that are dying. So I wanted to just point out the takeaway, because when I heard Ralph speak, I was just like, ooh, that's a really good lesson for people to know. It's not going to happen if you just think about it. But getting back to your original question about training out there, right now there's probably dozens of training organizations that are churning out end-of-life doulas. There's a huge variety of training programs. Some of them are online, some of them are in person, some of them are asynchronous, some of them work in a cohort. You really have to do your research, figure out one that speaks to you, and think about, what is it that you want to do with this work.
Alex, building on what Virginia described there, since this field is so new and so unregulated, anyone could call themselves a death doula with no, specific license required. As a reporter, did that worry you about when it comes to some of the doulas you spoke with? And, we have several listeners who've asked for some guidance towards, how to do the kind of research that Virginia described there, if they were perhaps looking for a death doula. From your reporting, what would you say to those issues?
That's such a great and important question, Bridget. As you point out, that's right. There is no official certification that you have to call yourself a death doula. And I would urge people, as they take advantage of this amazing profession, which I hope they do, to find the right fit, to interview people. And, you are really in charge here. You can ask to speak to past clients. And by that, I, of course, don't mean people who have died. Someone commented on the Instagram, the New Yorker's Instagram of the story, how do people leave reviews, which I thought was really funny. But the truth is, so much of this work is also about working with families and helping families through, not just the dying person. So people have experience and will be able to let you know what their experience was like with a particular person. It reminds me a little bit of looking for a therapist. Therapists are licensed. Doesn't mean everyone is the right one for you. You want to find the right fit. I found out about end-of-life doulas when I was looking for a birth doula. And with that field, also, you want to find someone whose values and whose temperament really, I think, aligns and brings something to your own experience. So I'd really encourage people, get on the internet. You can look at INELDA, the International End-of-Life Doula Association, which will list doulas all over the country in your area. You can just do a simple Google and start finding out who's doing this work and getting in touch with people. You have an element of choice that it would be a good idea to exercise in this realm.
I want to bring in another caller, David in Park Slope. David, you're on WNYC.
Yes, hello, thank you. My wife has advanced Alzheimer's and is in a nursing memory care facility, and she's on hospice care. What would the approach of a death doula be for a person in that situation?
Oh, David, so sorry for you. These are hard situations, and I understand when having your wife in a memory care unit and a separate and away from you, it can be challenging and emotional. As an end-of-life doula, I think of two things, and this goes back to what is not only highlighted in the piece that Alexandra wrote, but what she just said right now, which is it's about your wife and it's about you. And so it's about supporting both of you through the process and helping you both come to an understanding of what's happening and just balancing where you are now and what would you like to see in the future.
David, did you have a question?
Yes. Under Medicare hospice, we did have or do have what's called a spiritual provider through the hospice service contract. And they don't call themselves a doula. They were helpful early on, but unfortunately, one of the person that we have assigned got reassigned somewhere. So that I had some affinity for that. But they call themselves a spiritual advisor.
So a spiritual care advisor is not the same as an end-of-life doula. They are also somebody else that's a part of an end-of-life care team, just like a nurse or a social worker or the doctor, the end-of-life doula. We each have our own roles. And while there is some overlap between all of us, we each try to stay in our own lane and do our own sort of role within this. So you could have another spiritual care counselor brought in, or you could shift to bring in an end-of-life doula. And you might find that the end-of-life doula will be able to provide some of the aspects that a spiritual care counselor would provide, but they would also be able to do much more, such as things like legacy or, talking about a life review with your wife or, looking at family issues with you and if you have, children or anybody else that, is in her sort of circle of care.
David, thank you so much for that call and those questions. And we wish you all the best as you go through the end-of-life process with your wife. Alex, before we wrap things up, I just want to put a fine point on it because a lot of listeners have asked questions related to the cost of a service like this. Is it covered by anything, by any Medicare, or are there any ways to fund it, and how much does it tend to cost? Can you just give us some of the details around if someone was interested in it, what they could anticipate, spending on something like this?
It's such a good and important question. The first thing to say is no, Medicare and insurance will not cover this service. And there are a lot of different things to say about that. There are advantages and disadvantages. Obviously, cost is a disadvantage. One advantage, potentially, especially people who practice this believe, is that they're not limited by certain regulations and insurance policies, as hospice, for instance, is. The question of cost really depends on the doula and on what the service will be. I've spoken to doulas who, for instance, offer packages, maybe a 3-visit package that would be, say, in starting in the $1,800 range and going to maybe $3,000. I've spoken to doulas who offer a la carte options like funeral support and planning for $225. And then there are doulas who work with people over a much longer term period of time and might have different arrangements. One thing I do want to say to anyone who might be looking at the cost of this thing and worried about it is that a number of providers really are invested in making sure that this work is accessible. Many, many of the doulas I spoke with either practice on a sliding scale or offer some of their services to free to clients who can't afford to pay. There is a kind of social justice sense behind a lot of this work because people believe that this should be widely accessible. So I would encourage people to, again, investigate what their options might be before they say this is a luxury that I can't afford. Virginia, who's right here, Virginia has a private practice and she also volunteers with a hospice. The client, Eleanor, who Bridget, you mentioned early, who opens the piece, Virginia sees Eleanor at no cost because she was sent by Eleanor's hospice to volunteer. So if you have a hospice arrangement, either for you or for a loved one, you might ask the hospice, hey, do you work with any end-of-life doulas? Do you have anyone like that on your team? So there are options, and I think those options are going to continue to grow.
I want to thank you both so much for joining us. I've learned so much, and I feel like so much of our audience has benefited from this conversation. Encourage you to read Alexandra Schwartz's piece in The New Yorker. Virginia Chang, Ph.D., is a death doula and author of the new book, Preparing for End of Life for Dummies. Alexandra and Virginia, I'm tongue-tied. Thanks so much for coming on the show today. I really appreciate you both.
Thank you so much for having us.
Thanks.